Sir, 1 minute, sir. This will just start. Okay.
Yes. Uh, the,
हाँ.
I'm
Sir,
occupational therapist.
sir,
My name is Dr. Subhash Apte.
sir, 1 minute,
And,
sir.
uh,
Sir, I'm just checking at YouTube. I will give you the introduction. I will give
yes,
the
yes,
yeah. So, welcome all. Today, we are very fortunate to have the senior most occupational therapist of Ahmedabad, Dr. Subhash Apte. Apte sir has been the pioneer in the field of occupational therapy in Gujarat. He is a graduate from the prestigious KEM hospital, and sir has led the very prestigious BM Institute of Health till his retirement time. And today also, he heads the Gujarat Spastic Society, which is doing lot of good work for the neurodivergent children, including making changes in the laws for these special children, which is so important, getting the government support and many other programs Gujarat Spastic Society does. He also has been recipient of many awards for this pioneering work, and he also has written books for these children. So I welcome Dr. Apte sir
thank you.
this YouTube live, since we are very fortunate to have his talk, his lecture in the roadmap to Autism 2, which we are starting from 12th of December. And so we will prepare a little bit of background for our session, and we will also get to understand what Sir has been doing all these years. It will be very interesting. Sir, so my first
Yes,
question, since most of us would not know what is uh, the occupational therapy.
yes. Occupational therapy is very simple. The term itself, it will give we can understand. It means occupation.
Yes,
Occupation means activity. In other words, occupation means activity. And what we can say is that the activity has various components.
okay,
And to do any activity, one thing we need is a nervous system,
yes,
involvement of nervous system.
yes,
And another thing we need is a mental health. Our psychological aspects, they play very important role in the activity. Our neurology plays very important role in our activity.
yes,
And of course, our musculoskeletal abilities, they also play very important role in the
yes,
activity.
yes,
As the old saying says, that empty mind is devil's workshop.
yes,
So many of our occupational therapists, they don't like that term.
yes,
But I think occupational therapy started from that. Okay,
okay,
actually it started with the working with the mental health.
right,
And in the ancient times also, the persons who are having the problems in mental health, they were given various activities so that if they remain busy in the activities, their mental health will improve. That was the concept. So that is how occupational therapy started.
okay,
And by activity, we can classify activities in various different subgroups.
okay,
One subgroup is, of course, major subgroup is ADL, activity of daily living.
yeah,
So for the any newborn child also, first thing which comes is the activity of daily living. Uh, it starts from feeding, uh, taking mother's milk, and then toilet training and taking bath and brushing and clothing and everything. So activity of daily living is the first activity any human being has to do
Yeah.
after the birth, after immediately start doing after the birth. Then another is the big activity will be uh, locomotion and community, having interaction with other people. So that will be another major activity which the child which is having, which is from 1 year to say 3 years, the child has to do that activity, that they have to interact with other people, they have to move from one place to other place, and try to understand things which are there around him, or
Yeah.
understand the world which is around him. So of course, for to understand the world around, that is what we keep on doing for whole life. That
Yes.
we try to understand our environment. In it may start from a small bedroom and it may extend up to whole world. So, but we try to understand our environment, and to understand our environment, what we have to use is, of course, our sensations.
Correct.
Very sensation we have to use, then we can understand what are the things going on around ourselves, and then we have to behave accordingly. So, if any activity is there, it doesn't come in only with the movements, but along with the movements come the sensation. Okay,
Yeah.
simply if we understand that occupation means activity, and one of in my books I have written that just like the human beings keep need food, just like human beings need oxygen and water, similarly human beings need activity.
Yes.
Without being occupied or without activity, the human being cannot survive. So
Yeah.
that is what. So that is our fourth basic need. Our
Ye-
first basic need is oxygen. Our second basic need is water. Our third basic need is food. Fourth might be shelter, of course, and
Yes.
fifth will be activity. So without activity, the human beings cannot survive.
Yes.
So now, what the occupational therapist exactly do?
Correct.
So it has been changing. If we officially the course of occupational therapy, it was started in UK 105 years back,
Okay.
and in India it was started 75 years back. So
Okay.
that time, uh, why it started is also very interesting. So that time there was a First World War and Second World War had taken place,
Correct.
and many soldiers were injured. Some of them had amputation, some of them were either having all four limbs amputated or both limb amputated. Some of them had a injury in spine, so they were paralyzed, or they were having head injuries. And that time, the military hospitals, there was one rule, or any hospital, that unless they are normal, they cannot be discharged from the hospital.
Okay.
So these soldiers were in the hospital because if the leg is amputated, they are not normal. So
Correct.
till they are in hospital for months or years together, lying in the bed. And that time the hospitals were only bed, nothing else. Uh,
Yes.
Now modern hospitals have TV and many other things, but that time only nothing was there. So the patients, they did not have any occupation.
Oh,
So because they did not have any occupation, they started having depression.
correct.
And many of these soldiers who were admitted in such military hospitals, they started committing suicide.
Oh,
So that is the reason why occupational therapy came in existence. So those doctors in military hospitals who were treating these patients, they thought that we should give some activity to these soldiers who are for so many months they are lying down in a bed in the hospital. So they started giving activity or occupation to patients in the bed.
Right.
And when they started giving these activities, they saw remarkable changes. The number of suicides reduced,
Yes.
and happiness was introduced because the activities which were simple activities which can be done in the bed, even by the bedridden patient who is
Yeah.
having spine affected, or who is having the paralysis, or who is not having legs and not having hands. So mainly the activities were of the entertainment type, or
Yeah.
some creative activities like drawing, painting, knitting, and that type of activities. So immediate effect was seen that the number of suicides drastically reduced.
Hmm.
Patients who were long-term bedridden came out of the depression, and they were happy, and they really gradually their physical health also improved. So that is the reason why occupational therapy started. And
Yes.
then these doctors and nurses, they jointly started a course
Oh.
105 years back of occupational therapy.
Oh.
So that is the introduction. And uh, when I tell people what is occupational therapy, I also tell them about the Hindi movies.
Hmm.
So there was a very famous Hindi movie, Munna Bhai MBBS.
Yes.
The people who are listening to this video, they might have also seen this movie sometime. And
Yes.
Mumbai MBBS, it's somewhere it is advocating occupational therapy. If someone can remember the scene of playing that carom,
Yes.
Babaji was he was used to like carom,
Correct.
and but because of aging and other depression, he stopped taking the oral food.
Yes.
He was dehydrated, then admitted to the hospital, and doctors were trying to put intravenous fluid.
Correct.
So this Sanjay Dutt, he told, why you are giving intravenous fluid? Why not by mouth?
Correct.
And he brings the carom inside and start playing carom. So because of that carom, again the Babaji comes out of the depression and start having the orange juice and everything, and he's saved from deathbed. So
Yes.
some of these occupational therapy things, though in the comedy fashion, but
Yes.
are very nicely shown in these two Hindi movies. One is the this Munna Bhai MBBS. Other scenes also that it was really there that giving the activity or dancing in hospital was
Yes.
prohibited by the medical fraternity.
Correct. Correct.
And that was exactly what Mrs. Kamla Nimkar, who introduced occupational therapy in KM Hospital 75 years back. She also experienced same thing in KM Hospital also when she
Ye-
introduced occupational therapy and started giving the activities to the patients in the ward, in the wards of KM Hospital. Most of the doctors, they resisted. They
Yes.
did not. So from there, the journey of occupational therapy has started, and gradually it is becoming more and more scientific. So uh, uh, occupational therapy at present, if we see, is in it has been in demand for, and its demand for occupational therapy keeps on shifting.
Yes.
And what I have seen, when I have been working as an occupational therapy for now 53 years. For so the last 53 years, demand of occupational therapy has changed from one condition to other condition.
Yes.
Uh, in past, in beginning, there was a huge demand for of occupational therapist in mental health
Correct.
and psychiatric patients. Then gradually there was a demand for from the orthopedic side also,
Yes.
because mainly spinal injuries. Then there were many patients with cerebral palsy. So that was one period, and recently gradually what has happened is uh, the children who were having cerebral palsy. What I am observing is that their number is getting somewhat less now. It is reducing.
Oh,
The
okay.
reason is because of the good gynecological care. So
Correct.
many of the prenatal and perinatal
Injury.
complications can be now avoided. So we are getting somewhat less number of cerebral palsy than what we were getting 10 years back.
Correct.
But there is a huge addition to that of the children having ASD and ADHD.
ADHD.
So these two conditions have they have come like a pandemic now. And I
Yes.
think in every house there is either ADHD or ASD child. So
Yes.
that has created a huge challenge to all the caregivers, not only occupational therapy, not only
Yes.
medical, but it is a very huge challenge to community itself and all the new medical fraternities. So what
True.
uh, we have to really understand what is autism also. So if we
Correct.
try to understand autism, simple definition of autism that it is a communication disorder. So if
Correct.
the child is normal, there is no hearing loss, there is no loss of intelligence, there is no
Yes.
any other oromotor problem, and then also child is not able to communicate, either
Yes.
verbal communication or non-verbal communication. Then we
Correct.
should actually call the child as a ASD, autism spectrum disorder child.
Yes.
But uh, unfortunately, uh, now the trend is that any child who is having huge behavior problems or
Yes.
some behavior problems, then they are branded as a ASD child. Uh,
Yes.
so there is because there is no uh, objective test for autism. What we
Yes.
use are the either cars or they are questionnaires. Basically, they are questionnaires which are to be answered by the parents, and
Parents.
so they are subjective. They are not objective tests, and that's
True.
why the case number of cases we are getting has gone a very huge number. And
Correct.
if the child is non-attending, non-attentive, if the child is having behavioral problems, if the child is having running around, not concentrating, not staying in one place, not taking interest in study,
Yes.
the child is having hand flapping or spinning, all these things, if the child is doing, the child easily gets branded as a autism spectrum disorder child. So,
Yes.
or ADHD, it is a attention deficit disorder.
Correct.
In fact, classical ADHD, ASD children are very less, according to me. But there are many children who are having some other problem, uh,
Right.
and they are also branded as a ASD child. Uh,
Correct.
but basically, what we have to understand is it is not a if the child is having behavioral problem, it doesn't mean he is
Yes.
having ADHD,
Yes.
ASD. But he
Yes.
might be having ADHD, he might be having epilepsy, and along with epilepsy, they have seen many children have a lot of behavioral problems. So there are many neurological conditions
Condition.
which may lead to the behavioral problem, and
Yes.
not only autism spectrum disorder.
Yes.
Now, uh, and there can be many reasons why it happens, why the
Correct.
child has a so many complicated behavioral problems.
Yes.
Uh, uh,
So,
what
so
we
before
see,
we go into the reason of autism,
yes,
what was more interesting and to me was when a child is sent to an occupational therapist for an assessment.
yes,
So, what would an occupational therapist look for in the assessment from the occupational therapist's perspective?
yes. Uh, in pediatrics, uh, first of all, what we see is how a child is presented to us, like the look of the child, whether it is neat and clean, whether it is uh, concentrating or not, sitting in one place. When he reports to the occupational therapist first time, whether he is responding to our questions, or whether he's trying to play with the toys which we give to him,
Yes,
whether he is taking command from his parents or not. So
correct,
that will be the first observation part of it, whether the child is has worn the proper clothing or not, whether uh, his or a facial face is clean, and whether he is able to give eye contact or not.
correct.
All these tricks will be becoming first observation. Then after observation, while doing that, we will also observe the gait of the child, where the child can mobility of the child, what is the type of gait. Then we'll also see his muscle power and his muscle tone,
Yes,
and then we will check for the other sensory uh, uh, system. But
okay,
generally, when I will see the child, I don't jump to any conclusion immediately.
correct,
I give 1 month observation time
right,
for the child,
right,
and we always tell the patient to that we will today we are not going to give any diagnosis or
correct.
any comment for the child, but let the child come and play with us for 1 month, and
Yes,
then it is a interaction of the parents with the therapist, continuous interaction, not only 1 month, but
right,
many times quarterly, then yearly interaction. And we in BM Institute, we never used to give any label to the child.
right,
We will not say that, but many things we can really have first impression from our first observation.
correct, correct.
And of course, we will see the medical file,
Yes,
whether the child is having epilepsy or not, and all these things.
yes,
What is the opinion of neurologist?
correct,
That we will see. And then when the child plays with us, that time we really come to know uh, regarding his fine motor abilities also, his gross motor activities also, and we also come to know about his sensory behavior also.
correct.
So uh, generally, what happens is like many times the child, when the child comes, its gait is like he's walking on the toes,
Yes,
and so that is a sign of tactile uh, hypersensitiveness.
correct.
So child is trying to avoid the touch of the foot. So
Yes,
he's
on the
standing on toes and walking. So
yes,
we have to only see whether there is a spasticity or not. If the
correct.
spasticity is not there, and then also child is walking on the toes, we will keep it marked that
Yes,
it means that there might be some issue with the tactile sensation.
right.
And similarly, there is a we go for the generally these ASD children, they are having a problem with very hypersensitive to the uh, visual
Yes,
visual sensation. So that also we mark by bringing him to the activity and using different types of lights actually in that
yes,
case, and see what type of whether the child is having hypersensitiveness to the vision or not. And also, third important is the vestibular sensation.
Yes.
Spinning and running around. These are the symptoms child shows while playing with us.
Correct.
So or the child doesn't gets afraid or tries to avoid climbing the stairs.
Yes.
A child may be uh, afraid of playing in the playground, sitting on the swing
Right.
or slide. So then we can say that there is a vestibular sensation problem.
Correct.
Uh, and then we have to really so all these things we observe while through play,
Yeah.
and
So I
through
think
play. we-
as I can put together what you are trying to tell us is
Yes,
that an occupational therapist will look at the neuromuscular system, look at the neurological system, the neurological pathway starting
as
from
well.
the sensory to the motor execution,
And
and
yes,
also the processing unit, the central processing unit of
central
the
process.
brain,
Yes,
also the mental health of the child
yes,
or of the patient.
yes, yes.
So it's a very multi-systemic examination which is done directly or indirectly.
Indirectly. Yes,
Yes,
yes.
this is very, very
Multi examination and
yeah.
many times it may involve the counseling of the parents
Yeah.
also.
So that is
Um,
what we
yes,
do it as a consequence of our observations.
yes, yes,
Yes, yes. So this is definitely very interesting and very comprehensive test, especially for the homeopaths, because the homeopaths will basically need uh, the observations, which sometimes we may not have the time to spend with the child as much as the occupational therapist would spend during the therapy. So I
yes,
have number of times got a clue from the occupational therapist's report, and it is very important that we as clinicians coordinate with the occupational therapist treating the child
yes,
and ask them to send periodically a detailed reporting
yes,
of what the progress of the child is happening.
yes, yes. That is very important.
Yes.
And
So my next question then is that I have come across this term called sensory processing disorder. Since
yes,
occupational therapists
yes,
are examining the sensory system, if you could throw light on this,
yes.
and what is the implications of this in the behavior of the child?
Yes, actually, when we say sensory processing or sensory integration,
Yes,
these are uh, my impression is they are the very short terms.
right,
But like cannot just say sensory integration.
correct,
It is a sensory motor integration.
right,
So when we are doing any activity, or for example, if the child is trying to read and write, go to school, read and write.
right.
Now, both all the total mechanism is there working
Yes,
when
yes,
the child is trying to go to school. There
yes,
is a motor activity involved. Uh, there is a sensory activity involved, and so there is a totally sensory motor integration taking place.
yes,
And so while doing that, the child maybe the sensations which are coming, uh, the main sensation which is coming from either from the book or
yes,
from the teacher who is teaching.
right.
And the child has to take that sensation and do the motor performance of writing or understanding what teacher is telling.
Yes,
So between that process, there will be uh, other sensations. For
correct,
example, I had seen one child who was having very bad handwriting,
correct.
and we were not understanding why the child is having bad handwriting. Teacher used to complain having bad handwriting,
Yeah.
So when in my clinic, when I saw the child, he was doing using the having good grip,
Yeah.
could hold pencil properly, and could do the work nicely. But in the school, the child was having a very bad handwriting. Now, then I had to visit the school
Oh,
and see what happened, what is happening in the school.
okay.
So what we saw that the child's desks were not proper.
Oh,
The bench and desk which were provided to the child. One thing was there the child they were not having any backrest, so
ah,
it was only the bench,
correct,
and they were also not balanced properly. So
correct,
when child was trying to write down in the notebook, it was trembling. The desk were trembling. So
correct.
when the child has to use only vision, auditory sense, visual sense, and write down in the notebook. But
Yes,
in between, this vestibular sensation was coming
correct.
because of the imbalanced bench.
Yes, yes.
So, when we repaired that, the child's handwriting got repaired. So
Impaired.
we have to. These are the multiple things we have to see.
Yes,
Similarly, many times what happens is uh, the child sitting position in the classroom. Also, many times we have to organize properly. So
oh,
we visit the classroom
oh,
actually, and we have to work with the teacher to see that the child is try to eliminate the unwanted sensory inputs and
okay.
uh, try to give the proper sensory inputs so that the child can learn. So there are many techniques we have to use,
Yes,
but the sensory processing is a process where the child there we can just like we try to examine the tone of the muscles. There is a hypotonia, hypertonia, and a normal tone.
correct.
Similarly, the sensory also, there can be hypersensitive, hyposensitive, or normal sensitive child.
Yes,
So
yes,
the what we say is the if the child is having the hypo sensation of any
yes,
particular hyposensitive, then
yes,
the child will be having seeking behavior. So he will continuously seek that type of behavior
correct.
sensation.
Yes,
So what we see that the child sometimes keep on flapping and looking at the hand, flapping hand, but
yes,
it is not actually. He is not trying to flap hand, but
correct.
he is trying to get a visual
Visual
sensation,
stimulation.
visual stimulation. So
Correct.
it is a visual seeking behavior.
Yes,
So the same way the child might be having spinning behavior. So it is a vestibular
correct,
seeking behavior.
correct,
So this sensory processing we have to observe what type of when that what type of things the child is having seeking behavior and where the child is having as I told if the child is having a uh, uh, defensive he is
yes,
defensive for the vestibular sensation, then
yes,
he may not able try to climb the stairs. He
yes,
try not try to sit in the swing or
correct,
slide.
correct.
So these are the various sensory processing disorders which
Yes,
we have to see, and many times this defensive behavior is taken as a behavioral problem and
correct, correct.
not as a neurological problem.
Exactly.
What they say is before trying to fix the behavior, you try to fix the nervous system.
Nervous
So,
system.
so we have to try to fix the nervous system or
Correct,
strengthen his ability to face the either if he is having a hyposensitive, then we have to make him more sensitive towards the
correct,
particular sensation, or
correct,
if he is defensive to the particular
correct,
sensation, then we have to gradually give him that sensation and desensitize him,
correct.
and or then if it is not possible, we can give some adaptations.
Yes,
And in most of the cases, I think that adaptations are the only thing which can work.
Correct.
So sensory adaptations is
Yes.
the
Each.
treatment which can be very useful.
Yes.
For example, if we need to give proprioceptive stimulation to the child,
Yes.
uh, what I suggest is the weighted blankets and weighted jackets. These are the things. There are many children which I have seen. They don't sleep properly. They
Correct.
have sleep disorder.
Correct.
So if the child is having sleep disorder, we can actually design a special bedroom for
Okay.
the child, which will have a particular type of music, which
Okay.
will have particular type of lighting, or blue light or dim light, we
Yes.
can say.
Yes.
And with the child having lot of proprioceptive stimulation through weighted blanket and good bed.
Correct.
So then this and also we give the visual sensation to the child. So
Correct.
if we give such adaptations to a child, the child who is having sleeping disorder can sleep properly.
Correct.
Uh, the child who is having a problem in proprioceptive stimulation sensation and is seeking proprioceptive activity. So
Yes.
he will become the ADHD child. He will keep on running around. Why is running around? Because he's seeking the proprioceptive sensation.
Correct.
So instead of giving, how we can prevent it, we keep on giving him proprioceptive stimulation. So
Yes.
we can provide him the weighted jackets, we can provide him weighted cups. So if we give that way, then the child may become somewhat less
Yes.
running around and can sit down in the classroom and study.
Yes.
So
I think.
similarly, I have also designed different types of classrooms, adapted
Okay.
classrooms.
Okay.
So, for example, the classroom is designed like a having partition. So one child is having a separate cabin.
Yes.
Every child is then the and so towards the wall there will be different compartments. The
Correct.
child will be having four compartments on one wall. There will be four compartments on the other wall, and the child is sitting in the one compartment. So all the visual sensations are eliminated,
Yes.
and only one visual sensation will be there, the chart which teacher is wanting to teach him.
Correct.
For example, if the teacher is wanting to teach him vehicles, the chart of vehicle will be in front of him, and
Yes.
the other visual sensations are limited, and
Yes.
the teacher will be moving around. The child will be in the compartment. So
Correct.
there can be 10 children in 10 compartment in the same classroom,
Right.
and the teacher is moving, and every child will be having his own chart of
Correct.
subject which is to be taught to him.
Yes.
So that type of classroom is very helpful for a ADHD or ASD child also. So that way, adaptations is the best than doing any other thing
Correct.
to help the child to. So by giving adaptation, what we are doing is helping child to do what the occupation he is expected to do. So
Yes.
education is expected from is the occupation expected from the child. So
Correct.
we help by giving sensory adaptation. We help the child to do his the occupation,
Yes.
proper occupation to.
So as we can see that it's the expertise, it's a field in itself
Yes,
where we need to get into the nuances, and as homeopaths we need to tap into this resource to help our children. So we are going to study a lot more during the course of our roadmap to autism part 2, where
yes,
sir will share his experiences with his patients and get more into the details of this subject. So for today, this is an introduction. This is a small teaser. Do register. We put in the details for the registration for the course in the information below. and we will eagerly wait for sir to take up the session during our course. Thank you very much, sir, for this very interesting introduction to the occupational therapy. Thank you so much.
Thank you.
Okay, sir. Bye bye.
Bye.